space where beauty meets authenticity and transformation is not just a possibility, but a promise. I'm absolutely thrilled to introduce you to someone truly special, Dr. Rukmini Vinaya Rednam, the compassionate force behind the countless remarkable transformations in the vibrant city of Houston, Texas. Picture this: every curve, every contour crafted with care and expertise, not just by a board-certified plastic surgeon, but your very own cheerleader for self-discovery and confidence. Get ready to embark on a journey where we explore the art of science of feeling your very best self. This isn't just a podcast. It's your cozy corner of empowerment and inspiration. So pull up a chair, pour yourself a cup of kindness, and let's dive into the Confidence Doc podcast with Dr. Rukmini Vinaya Rednam.
Welcome back to the Confidence Doc podcast. I have the amazing Erin Ho with me right now.
I feel like I need a fan. That's this hair like Beyonce does right now.
She has been a guest on our show a couple times before, and she's fabulous. And I wanted to make and dedicate this entire episode to Erin. Erin is my physician's assistant, and I want to clarify because on social media, people seem to get irritated when someone says that. I don't own Erin. When I say she's my physician's assistant, it's because she works with me. We work together as a team, and I thought I really wanted people to understand better why Erin is such an important part of our team. So, Erin, can you tell people exactly what it involves to become a physician's assistant? Like, how did you get there?
Yeah. So a physician assistant is usually now it's a master's degree. You hold a master's degree. So you went to graduate school at an accredited physician assistant school. The training it takes to get there is very fast. Usually by the first year, you are taking classes within your 12 months of training. You're taking classes with second year med students who've already been in school for 2 years. And then you go on clinical rotations. So as a PA in training, most programs, they train you throughout all the specialties, with an emphasis on family medicine. So at the end of your training and stuff like that, you can get a job in pretty much any specialty of your choice. The only controlling factor is having a supervising physician who is willing to train you, especially if you're new or wanting to switch fields. One of the benefits of being a PA, I think when I first started looking at this job, was that you could switch specialties and stuff like that. There's a lot of flexibility too as well. And I think a lot of it is to do with work-life balance and stuff like that. But as a PA with a master's degree, you are able to diagnose, you're able to treat, you can prescribe medicine, you can see patients, you have a relationship with a supervising physician. But at the same time, you can run very autonomously by yourself, especially in rural areas where there are not a lot of providers, or you can run and work in a big team or in a surgical team like I do. So there's a lot of different roles as a PA. I think one of the things about being a PA is the role of a PA is what the physician and the PA determines the role to be.
Yeah.
It fulfills the need of what is asked for patient care. So it's pretty flexible, but it's pretty fun. I didn't go to med school, but you get to do a lot.
So people can understand how smart you are. Like, what kind of acceptance rate is it? Like, how many people apply for PA school in this country?
So the last time I was in PA school and I was helping out with their interview process, they said that they kind of stopped looking at applicants after 2,000 applications. And from the 2,000 applications, they interview maybe 200, 180. And from the 180 applicants who get an interview, largest class, which is from UTMB, which is where I graduated from, is 89 seats. And then the smallest class, which is like I've heard of, is like 34. So each year, only 34 PAs graduate. Like Baylor has, I think, 34 or 40 slots. And so most schools actually are very, very small. So they're not very big. But yeah, the acceptance rates, if you do the math out, it's pretty staggering. It's, I think, about anywhere from 3 to 5% acceptance rate.
So she's really smart, guys. That's what
I like people.
When you're saying how PA school, like there is a bit of a focus on primary care. So if you're someone like you who has an interest in doing something that isn't necessarily what a lot of your classes are, how do you even go about doing that?
I think a lot of that is you have to self-seek it out. So I was lucky enough that I had one elective rotation in my surgical rotations, because you do rotate through general surgery as well. Generals and OBGYN, like delivering babies and stuff like that. But during my elective, I got lucky that I went to MD Anderson here in Houston. I got put onto their plastics team. And my very first surgery was actually like a reconstruction case for like a mandibular reconstruction. It took the bone in the leg. They did some 3D printing, hooked up some vessels, microvascular, and that honestly, the reconstruction was what I fell in love with. So it was me seeking out different electives. I had to apply for that rotation, and then afterwards, it was me looking for a reconstruction, like a job for plastic surgery that did reconstruction, which is kind of how I found you guys.
Yeah, and Erin actually just saw an ad. And
it was Google.
Yeah, thanks, Google. And we were fortunate enough to get her. And like, kind of like when you first came in, like, how did you feel about it? Because I know you liked the specialty, but like, you know, when you first came in, like, what were like the expectations that you felt like you were immediately put on you?
I'm going to quote Dr. Boutros. He told me that I am like a newborn child. I'm going to poop and cost him a lot of money. That's what he told me the first 3 months. And then I'm going to graduate to be a toddler. And then I'll be cute, but annoying. And then I'm going to be like a high school where I'll make a little bit of money for him. And I'll be a little bit of a help, but still annoying. And then and then one day you'll graduate high school and you're going to be great. And then I'm going to love you. So that's kind of how that went. Yeah. I was a toddler for a while.
You can use that analogy going through residency as well.
Yeah.
That's how we start off as well. But I could say that, you know, I got to meet Erin initially. She had taken a job with one of my partners. And then we kind of got to working together a little bit. And then as my practice grew and I needed somebody and it just worked out and the stars lined up. And Dr. Boutros and I talked. He said, "Well, what about Erin?" And we've never left since. We've been inseparable since. So I will tell you, Erin is such a vital part of my team that there are certain procedures that I will wait if she's out of town to do another time. And it's not because I can't do them, but it's just because we have become such a well-oiled machine. I could tell you exactly how long it's going to take me if Erin and I are working together. The role that you have a lot of roles in our group.
Yeah.
But what are what's your favorite role that you get to do? But then let's describe all of them because I know that you know.
My favorite is definitely surgery. I love operating. You get into this zone where time kind of stops. I don't feel like I have to go pee. I'm not really hungry. I'm not thirsty. It's just this kind of zone where it's like the sacred space where you're kind of in your zone, you're grooving, you're having a good time talking, but at the same time, you're really just, you can only work. You're not allowed to touch your phone. You're not worried about the world. You're not worried about anything else but what's on the table and like your patient. Obviously, operating is my favorite place. I think that's one of the reasons why I think I have excelled at it so well, just because I do enjoy it. I think out of all of my friends, I think there's only 2 or 3 of us who are PAs who enjoy surgery. You put anyone else in the OR, not that they don't have the skills to it, but they just don't enjoy it, right? They just don't. Doesn't bring them joy. It's not what they want to do. They'd rather be comfortable in a chair. They'd rather be comfortable in a chair, not sweaty.
For 7 hours.
Yeah. Plastic surgery is a lot of physical work. I don't think people understand how much energy and how much work it is physically on your body. So for these big cases, we are constantly running and constantly moving and doing something. There's never a point in time where you're sitting still, which is what I love and I enjoy, and I think you do too, but I don't think it's for everyone.
No, it isn't. It's funny, you're right, we could be literally 8 hours in the operating room, and before I know it, I'm like, oh, it's been 5 hours.
It's the sunset. Hello.
Yeah, we got Usher radio on, and we're not, we're just we have fun, we talk, we chat, but we are focused on what we're doing, and it's okay, we just, and we've been doing this long enough as a team, especially that it's just kind of we just got, okay, I'm going to do this, I'm going to move over here, you come over here. And we actually have gotten comments when we operate at the hospital, because we work at different teams at the hospital, and they're like, man, you guys just really work well together. And I'm like, yeah, I guess we,
I feel like I'm pretty good at trying to see what you're going to do next now in surgery.
Yeah. In fact, sometimes you're better at remembering things that I need than I am remembering of.
I think I have a lot of it helps to have team members who help remind you, especially when you have big cases. There's so many moving parts. There's positionings, there's changing positions, there's putting sutures here, putting sutures there, there's changing this, there's changing that. There's so many parts, especially when you're doing multiple areas on the body, that you have to have someone help remind you. I don't know how anyone does that.
And, I mean, there are definitely other plastic surgeons. I will tell you that I think the newer generation, and I'm going to put myself in the middle of that because, I mean, I'm about 10 years out, so I'm not brand new anymore. But I think we've learned that, I think we can actually take better care of our patients by having a team of people. I think some of the real old school plastic surgeons are like, no, I can do it all myself. And I bet, and they can. That's how I've always been doing it. But I think that for me, it's also I get a little more balance in my life, being able to depend on some solid people. Mm-hmm. And I know that our patients feel super loved by it because they know you by name, and they're like, is Erin here today? Oh, is Erin's gone? Where is she? What is she doing? So I think that it's having a team approach has been really, I think, good for patient care too.
Yeah, and I think we also have a really solid support team, especially in and out of the surgery. So Gladys and Lauren helping with clinic and when we're operating, and Cheryl and Candace and stuff like that.
So for our teams, we are part of a big group called My Houston Surgeons, but we all have smaller teams within that for each doctor, for each surgeon. So on my team, we have Erin, we have Gladys, who's our medical assistant. We have Lauren, who's our RN, our nurse. We have Cheryl and Candace, who are our patient care coordinators. Yeah. So it's you have a really amazing team of women. And that's a common theme on most of my episodes. It's strong women. But all of us work together to help provide that patient care. I'm involved with every part of it, and Erin often is involved with every part of it too. But because of that, we can get back to people fast. We can make sure that we know what's happening and what's going on. I love Erin gets texts from one of our patients when she's on vacation. Sometimes she'll send her photos from her trips and be like, she'll say, share with everybody, Erin.
Yeah. I love it. I love those. So that's probably my favorite part of being a PA in plastic surgery. The part that gets me the most uncomfortable is probably when expectations do not meet reality. And you have to have that conversation, that uncomfortable conversation where what they're seeing in their head and what they're expecting in their head, and you're trying to explain it to them that it could be that it physically cannot be unless we remove ribs and stuff like that.
Yeah.
Or two, you put a lot of work into something, creating something for someone, and that you think is really good work, but at the end of the day, they don't like it, or they think it could be better, or they just don't like you, and that's okay. But I do take it a little personally, and I want you to feel good and stuff like that. But at the same time, we're not magicians, right? Yeah. So I think that's probably the hardest part: getting expectations to be met with reality and finding a good balance, a good medium in between. That's probably the hardest.
That's challenging. I mean, that's probably one of the most challenging parts of my job.
Yeah,
it's it is really hard to walk in there and feel like you've disappointed somebody. And knock on wood, that's not a conversation we have to have often.
Yeah.
But it is hard because I think at the end of the day, we all want people to feel happy. And so I think that is a challenge. The other challenge is paperwork. About paperwork. I saw a video recently on TikTok where a doctor was replying to a comment that said, what do doctors do all day? And they were replying to the fact that you're in clinic and you might see your doctor for 10 minutes and then or you're waiting for them and what are they doing?
Yeah.
Now, we're different than primary care. We don't have the same constraints of seeing as many people in a day.
I like to disagree. They see, so my friends they have 15 to 30-minute slots per patient. Granted, their exams and their checkups is a lot different than ours, but then they have time to chart. They have time throughout their day to chart, and
which we don't really do.
Really. And then we go to operate. So if they don't finish day one, they can lunch break day 2, do the charting.
Yeah.
Or when we go operate, we can't touch
You
your phone.
can't exactly be doing
So
that's true.
I think that's...
I think I guess my mind is that we spend a lot of time. Like I can spend as much or as little time as I want to spend with my patients the next day. It just means that, we have piles of paperwork because it's part of your documentation. We need to do it. But at the same time, I love the operating room. I really do. It's my favorite place. But clinic can be really fun sometimes, especially when we're seeing those happy reactions. Like I said, we had 3 criers today, but these are happy criers. So I do love those. I love seeing that happy cry. Then there's just times where it's just going through, no surgeon's going to tell you clinic's their favorite place, but it is the place we get to meet new people. So, I mean, I can't have my job without having clinic because that's where I get to meet somebody new that we get to operate on.
Yeah, I love clinic. I don't love it as much as operating room, but I don't hate clinic. I think I hate paperwork so much I forgot how much I hate
And on paperwork is not even really paperwork. It's on a computer.
Yeah.
We don't want that much paper.
Yeah. But if I had to dislike something, that'd probably be worse.
Well, I do dictate. Erin's still a typer.
Yeah.
Someday I might get you to dictating because it's just so much easier just to talk it out. And then you just, hit the button.
Maybe I will try that someday.
Someday.
But hearing myself talk? Oh.
Well, it's actually really funny when I do it at home because my kids will mock me. I'll be dictating. They'll be like, things.
It's always impressive how fast some doctors can dictate. I mean, they can dictate in one breath, like an entire operating report. They're like, blah, 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 blah.
Oh, I've fallen asleep dictating too. So I feel so bad for the transcriptionist on the other end because they're like, maybe she's gonna talk again, and it's like, nope, I just fell asleep. Let's just start over.
Yeah.
But so I mean, clinic and OR is our main, the main 2 things we do. Sometimes we do all of it in the same day. That's where it really helps to have our team. We have Gladys and Lauren. Lauren has her own clinic. And so you will always see us, you're never going to just never see me again after surgery, but we do divide it up so that you might have some visits where you're seeing Lauren and Gladys, you might have some visits where you're seeing me, so you have some visits sometimes where you may see Erin, but we do that way, you're always, everything's always getting back to me if it's necessary needed, but otherwise, you're always seeing people and that you trust and build a relationship with, which is important. I think that PAs in surgery is a growing. I think that there are more people realizing that this is a really great person to have on your team. And I think that there's different types, right? Plastic surgery PA is going to be very different than a neurosurgery PA, right?
You could be a plastic surgery PA or a surgical PA and never go to the OR or not scrub it at all. Sometimes it's just taking care of surgical patients. So it just kind of depends on what you like to do, I feel at the end of the day.
Yeah.
And what you want to do and how you want to bridge the care that's not met. Yeah, there's tons of PAs who don't operate and they consider themselves surgical, and that's because they take care of surgical patients. So you can find PAs in pretty much any specialty. The only one is probably anesthesia. But PAs can practice in almost any specialty. And then at the end of the day, we can also switch. And so that's always one of the benefits of something.
Though we hope Erin never chooses to switch from plastic surgery. It is interesting to say you could be a plastic surgery PA in 2 different practices and have very different roles. There's some PAs who choose to become full-time injectors. So they don't actually, they don't do surgical. They work for themselves or they work for somebody else. There are a lot of pathways you can take from it.
Yeah, I think it's a very flexible career and position. But at the end of the day, it's what makes you happy. And I think that's...
And I think that's why also when it's I'm always proud to be she's my PA. And it's because you do make a relationship. And there are things that I would feel comfortable having Erin do that I may not have another plastic surgeon coming in who wants to assist me feel comfortable them doing it, because we actually have a very similar style now because we've worked together so long. So it's she's works at such a high level and I trust her so much. And I think that that's something that you can't just find every day. So
I think I love the OR just because it's where it's my happy place, right? Like you said, I enjoy being in the OR. I like the feeling of OR. I like scrubbing in. I don't like the distractions. I like being in that focus, single-minded, this is your goal. And I think because I love it so much, like I said, that's why I care so much. And that's why I think that That's why it works so well.
It's like funny, like you don't worry about other things.
Yeah,
You might
you really
worry about, like it's just like you're focused. And we're not. I am not the kind of surgeon who throws instruments and yells at people. We drop instruments because
She drops it first. She usually drops it first.
I mean, sometimes things flip. But otherwise, like it's a happy place.
Yeah.
And usually we have such great anesthesiology teams at the different places we work with that, like, yeah, it is kind of our escape. And at the same time, we're going to do something good for somebody else. So I think it's a pretty amazing thing to do.
Other parts of my role, I feel like having a really good team base, like it's just checking up on other people and making sure that things are going to run smoothly for surgery. There's a whole bunch of moving parts of surgery that people don't think about, like anesthesia, getting the room ready, getting a surgical
How are you going to get positioned?
How are you going to get your instruments? Are they clean? Do you have the supplies? Do you have the medications mixed up for you? So there's so much work that goes behind scenes of surgery that I don't think people give enough credit for the people who do that work. And there's always room for more help.
I know you double check so much stuff. You make sure there's things that I will literally forget in my brain. You're like, remember this? Did you remember to do that? I told you to do that. And, and it's so it's good that there's so much double checking. And I think that like, that's just part of the reason that we're able to provide such smooth patient care too, is that like it's not any one person that's like has to remember every last thing.
Yeah.
There's been times too where we're in surgery and I'll be like, Erin, what do you think? And you're like, the answer. And I'm like, okay, Erin, you're right. Let's not do that. So I think it's good too because it's like over time as we've gotten to become more in sync with stuff. It's like I know I can ask you. I know you can answer something that I know in my head, but it's like there's the voice that needs to tell me and be like, no, that's what you're thinking. I'm like, okay, yeah, you're right.
No, I think learning is always part of this, right? I always love learning about new techniques and stuff like that. I think you do a really good job teaching it too. So it's not just like doing similar things or like do the same thing. It's learning constantly and improving and like evolving too.
So if we had somebody listening, let's say today, that's like, I really want to look into becoming a PA in surgery, like what advice would you give them? Because you do have to kind of make your own path.
I will have to say my number one advice would to be truly get some experience and shadow PAs and get their honest opinion as to whether this is something you want or not. I cannot tell you how many times. So I'm one of the lucky ones where this is my first job coming out of PA school. Most of my friends have gone through 3 or 4 jobs at this point in their career. And it's not because they had bad bosses or anything, but it's just not what they wanted to do. It wasn't in the specialty or it wasn't what they thought. And I've asked a lot of them also like, hey, if you could go back, because I can promise you PA school, like I said, it's not easy to get into. People don't really have it's not a backup choice for anyone. So going back, would you do it again? And you'd be surprised how many of them would probably say no. So I think for me, it's really go out there and see if this is something you truly want. I think one of the common themes I see sometimes as a PA is because you have the knowledge, because you have the skill, you want to be the doctor, but you're not the doctor at the end of the day, right? And that's part of the role, and I understand that, and I fully accept that. I fully accept I'm not the doctor. At the end of the day, it's not my shot to call. I work on a surgical team, therefore she is my surgeon, and so I follow her role and I follow her lead. I think some other PAs might have a difficult time with that, especially in other specialty as well, especially in a clinic setting where sometimes you are by yourself and you do get to make that call. But like when another person comes in, I think it's hard. So I definitely would just do your research. It's very difficult to get into, but it's not impossible. Getting your foot out there, talking to PAs, getting involved in the organizations, that really helps.
I think shadowing helps a lot too. Like we had a young lady who's been in the operating room with us. She wants to go to PA school. She came to clinic and she's a little quieter. I wasn't sure because sometimes surgery, but like she clearly is enjoying herself because she did not want to leave.
Yeah, she stayed through the storm.
She stayed through a storm. She's in there. And so like that like made me immediately want to teach her more.
Yeah.
So today I was like, see this picture? This is what this is. Because I can tell she's like, this is kind of cool. I kind of like this.
Yeah. She has to come back, by the way, to see more surgery. And I was like, yeah.
Yeah. So I love that. I love that. That means like when people are interested, it like because we like it so much, it makes me more excited to be like, well, let me teach you. I am so glad that you were able to share a little bit, Erin, because you are such a valuable part of our team. And I think the world could use more PAs like you. So we joke. We have another PA in our practice, Kara. And together they're Karen, even though that name has gotten a bad rap for it. But it's because they are just like such dedicated team members. They literally like do the name PA right. Like they do everything right.
I really did learn from the best, though. So from you, from Kara, from Dr. Petros, like I really did learn from the best. And so it took a lot of work to get me here because I really, they didn't let me touch anything at first. The first, like, I don't know, 3 months, I think he allowed me to cut. Like, that was it. Cut the suture.
You're gonna do that wrong.
Yeah, you're going to do that wrong. Redo it.
But it's, it's a great specialty. I think if you're not sure, you want to do something medical, you're not sure, I think it's something you should definitely consider because, like I said, I think it's something that's going to continue to grow and evolve. And I think there's definitely going to be more PAs involved in the future of health.
I think it helps bridge a lot of the gap, especially with not many people want to go to medical school anymore. Like the numbers, unfortunately, are not as high as before, like in the past. And so if you have less numbers of doctors, but more numbers of patients who are living longer, more people getting insurance, like someone's got to help take care of that bridge. So yeah, I'm excited to see what PAs are able to do in the future.
I am too. Well, thank you so much, Erin, for coming on, sharing your story. And thank you all for tuning in to the Confidence Doc podcast. We'll talk to you next time.
As we wrap up another episode of the Confidence Doc, I want to extend our heartfelt thank you for being a part of our community. If today's conversation resonated with you, remember that Dr. Rednam and her team are here to support you on your journey to self-confidence and beauty. Your story is unique, and it's our privilege to help you create the masterpiece that is your life. If you'd like to book a consultation with Dr. Rednam, you can visit her webpage at drrukminirednam.com. Fill out a contact form, and one of her coordinators will get with you accordingly.